If you have a pelvis, you need pelvic floor therapy. We treat men for diastasis recti, so that's separation of the abdominal muscles. That's not just a postpartum condition.
Welcome to Wisdom Beyond the Womb. I'm Trisha Harris with Trisha Harris Photography, and today we're talking with Dr. Klein, a physical therapist. Hello, Dr. Klein. How are you today?
I'm good. How are you?
Good. Thank you for being here today. I'm excited to see how physical therapy benefits moms, babies, and beyond. So tell us about yourself. What's the name of your business, and what do you offer?
Sure. So I'm a pelvic floor physical therapist. I've been doing physical therapy for 18 years. I started in orthopedic therapy and then transitioned into pelvic floor therapy, basically because I had 2 kids and wanted to learn more to help myself. And now I learned a whole new world of physical therapy. So I focus on the pelvic floor for women, men, and now for children, for pediatric patients. And I opened up my clinic, Embrace Health and Rehab, in Rockledge in 2021.
Wonderful. Pelvic floor therapy.
Yes.
What is that?
So we focus on the muscles within the pelvis, and there's so many different conditions that can happen that affect our pelvis. But also, especially like during pregnancy, we see people who are pregnant, in postpartum, recovering from a C-section or from a vaginal delivery, and we get to teach women how to push their babies out effectively. So trying to decrease risk of perineal tears and prolapse.
Okay. What are some of the misconceptions around pelvic floor therapy?
Oh, misconceptions around pelvic floor therapy. So since it's called pelvic floor therapy, I've had a lot of people say that they won't get on the floor to exercise, thinking that for whatever reason they need to be on the floor. But the pelvic floor is termed that because the muscles are at the bottom of the pelvis. So we call them the pelvic floor.
Perfect. And they do these services at your office?
Yes, my office.
Do you create a game plan? How do you test if their pelvic floor is good or bad?
Yep. So the first visit, every visit in our clinic is an hour. So we send quite an extensive intake form. We ask a lot of questions. That first visit, we're just face-to-face talking like we are now about what's going on with them. We talk about, I like to educate. So we'll educate people about their bladder, their bowels, their organs, their muscles. We do an external assessment. So we look at how they breathe with their diaphragm, posture, movement mechanics, so many different things. And then we're trained to internally assess pelvic floor muscles. So as long as the person's comfortable with that, we can assess vaginally and or rectally, and then set up a game plan for homework and follow-up visits.
Once you get to the follow-up visits, what's the typical care plan look like for this? 1 and 2 visits were done, couple visits, and then at home work, or both?
It depends. Some people are much better after 1 or 2 sessions. And I like to say that we give them so much in that first visit. It's kind of like 3 or 4 visits in a different clinic, let's say, because I used to work in other clinics. I have that experience. And that's one main reason why I opened my own practice, so that I can do things the way I want to. So you get so much to do during that first session. If you keep up with your homework, you don't need to come back in very often. But the second visit, we review homework, we review symptoms, and then we progress from there. Another misconception is that we have to assess internally. We never have to, and we usually don't do it again after the first session unless we're working on calming muscles down. That includes more manual work.
Wonderful. You talked about pushing the baby out for pregnant mamas. What does that help with when they're seeing you before they give birth?
They learn how to actually relax their muscles. A lot of times people think they need to push the baby out with their pelvic floor muscles. It's really the uterus contracting and pushing the baby out. They need to learn how to let those pelvic floor muscles relax and lengthen, and that's actually really hard to do. So we're able to physically feel their muscles, teach them how to lengthen their muscles, which essentially feels like a push, but it's lengthening and relaxing to help guide their baby out.
So is the recovery time better for moms once they've gone through pelvic floor and given birth?
Yeah, it can be, especially if they don't tear.
Okay. A woman's body ends up going through a lot of trauma during birth, and so how does your services heal them from that trauma?
Yeah, so we will, of course, incorporate a whole body assessment again postpartum. We will check pelvic floor muscles, and we work on scar mobility, especially if they needed stitches in the vaginal area. So we can work on scar mobility there, assess them for prolapse, and just teach them how to restore their core and their pelvic floor.
Wonderful. How are patients usually connected with you? Do they call you up and say, hey, I need to fix my pelvic floor? Or are they usually referred by their providers?
It's a big mix of both. So we get a lot of referrals from providers. A lot of people just find me through a Google search or social media.
Okay. Pelvic floor is still very new. What's the need for it if you're not pregnant?
Oh, there's a huge need for it if you're not pregnant. So pelvic floor physical therapy is not just for pregnant and postpartum women. It's for anybody with a pelvis. So if you're having issues with constipation or other bowel problems, urinary problems, pediatric health, a lot of kids wet the bed past when they should be wetting the bed, just as one example. So we can work with pediatric patients for certain conditions. If you have a pelvis, you need pelvic floor therapy. We treat men for diastasis recti, so that's separation of the abdominal muscles. That's not just a postpartum condition.
Some people may have had their baby years ago and were never told about pelvic floor therapy. Is it too late to see you?
No, it's never too late. My oldest person was 98 years old that I worked with.
And what's the youngest you've seen a patient?
So far, 13
13
years old.
Juvenile patients.
Yeah.
Okay. We talk a lot about the trauma with the vaginal birth and pushing the baby out. What about moms who give birth via C-section? Do they need pelvic floor therapy as well?
Yeah, absolutely. So a lot of times people say, oh, I had a C-section. I didn't think I would need pelvic floor therapy because, the baby didn't pass through my vaginal canal. But just the act of being pregnant can lead to some pelvic floor issues. And so we can definitely work with moms who've had a C-section as well.
Great. Tell us, how would we find out about making an appointment? What are your web pages, social media? How do we get in touch with you?
Sure. So my website is embracehealthandrehab.com. We offer online scheduling, so you can check and see who is available. There are 3 of us in the clinic, and click on either a date, a time, or our name and you can book yourself online or call 321-300-7117. I answer the phone. We don't have front desk, so sending a text message is fine as well. And then I have free resources on my website.
Wonderful. Thank you so much. And tell me, we all have an experience within our business that just kind of carries us through and excites us. Tell me about a patient that you've helped and how they've overcome the struggles that they were facing through pelvic floor therapy.
I think my favorite people to help right now are people who are dealing with pain with sex, and they think that that's just a part of their life that they'll never get back. And so there's not really one specific that I can think of, but when I'm able to help somebody overcome that, it's very rewarding.
So part of this show is bringing awareness about certain things that we can do before they become a frustration, right? And I feel pelvic floor therapy is one of those that it's so new, people haven't heard of it until it's after the fact. So how can we get them in front of you beforehand? Like, when is the earliest? How can they prepare? And what does that look like and the benefits later?
Yeah, absolutely. So people can definitely come and work with us before they even think that they have an issue going on. We can give them all the education they need about the bladder and the bowels, because nobody else ever teaches us that. You have an hour one-on-one with your therapist, so we can teach you every little thing, assess your muscles so that you know how to actually contract and relax them, because a lot of people just aren't aware. They think they're doing it right, but they might not be. So you can take that education and the experience with us in the clinic and apply it to your workouts to help you prevent pelvic floor issues from happening in the future.
Having worked with patients during their pregnancy and prepping them for their delivery, what are some things that you're doing so that they have less tearing or trauma in the pelvic floor area?
I think the biggest thing is teaching them how to lengthen their muscles, number one, but then we also go over different positions that they can labor in and then deliver in to help avoid a perineal tear, even if it's just lying on their side or in a little bit of a modified squat position, and then just making sure that they're talking to their healthcare providers about that, and if their nurses and doctors are comfortable with them trying to deliver in different positions, because that has been found to help reduce the risk of tearing.
Amazing.
Yeah.
How soon after giving birth should somebody see you?
Usually, I will say about 6 to 8 weeks, just around the same time they would go back to their OB. But they can also come in sooner if they're having issues that they think we can be helpful with.
Thank you so much, Dr. Klein. Is there anything else you want us to know about your business or the services that you provide?
Yeah, sure. So a lot of questions I get, of course, are if we take insurance. So in my clinic, we do take Medicare. We're working on getting TRICARE, and the rest of the insurances we are called out-of-network. So if you have out-of-network benefits with your insurance provider, you can be reimbursed based on your plan. So it's nice to know what you have as far as physical therapy benefits. But the beauty of that is that we're not limited by insurances telling us what to do, how many visits you get, and all sorts of hoops to jump through.
Wonderful. Thank you so much.